Good afternoon, everyone. Thank you for joining us for this Tele-Town Hall with Mayor Woodfin. I'm Rick Journey. I will be serving as your moderator during this call today. A few things before we begin that I'd like to let everybody know. We will probably have more joining as the call progresses. If you have a question during this call, please press 7 on your dial pad. Please press 7 on your dial pad, and you will be able to connect immediately with the screener, and you can provide your question to them. They'll put it in the system so we can answer it immediately. So we will do that. Remember, just press 7 on your dial pad. Secondly, during this call, we also want to know what you are thinking, what your concerns are, what your general some observations on a various group of questions. So at times throughout this call, we will pause to ask you a question and tell how you can answer that particular poll question during this call. We have several people here to address your questions, so we will be working through that over this time that we have together. Thank you once again for your service to the city and to the people of the city, and thank you for joining us on this phone right now. With that, let me introduce Mayor Randall L. Woodfin.
Hey, good afternoon to the men and women who make up the Birmingham Police Department. I want to thank you for being on this call. A couple goals. One is to give you some brief thoughts, and then 2 is to spend more time on any questions and or concerns you all have and see what we can address. Along with me in this room, we have the Chief of Police. We have Deputy Chief Treadway. We also have Jill McDisaac of HR, and our other senior leaders of the mayor's staff in the room. The short version is I'm speaking with you all this afternoon because I know many of you are concerned. You're concerned about your families. You're concerned about the professionals to your left and right who you serve with every day. But I know many of you all are also concerned about the residents that you protect and serve every day. My first line of concern is with all of you. And so let me, as your leader, let me, Chief Smith, along with Deputy Chief Treadway, and others tell you what we're doing for you at a high level, and then we can answer some of your questions. As many of you all know, yesterday, this week, we put in place a shelter-in-place order. A large part of this, if not majority of this, is to benefit of our residents, but we believe this also benefits you, which is to decrease the number of potential people you might come in contact with. Second, Chief Smith is working to increase the amount of personal protective gear available to each of you. We have just placed a significant order for supplies and should have it in place with time to spare. So this next point I want to make is very, very important. We do not have a supply shortage of PPE. I want to repeat that. We do not have a supply shortage for PPE, and I think Chief Smith can give you all some more detail on that if he would like. The third thing is this. I want to urge each of you to follow all the protocols for engaging the public, especially calls that are specifically related to residents bearing flu-like symptoms. We need you to be safe because we care about you. With that, what I want to do is turn it over to Chief Smith for any remarks he wants to make, and then we can get into some questions and answers.
First, I want to thank all of you for tuning in. I think the most important thing is what we're trying to accomplish here is ongoing communication. Most of the communication that you've received has been through by way of your captain, by way of your lieutenant or sergeant. This way, we wanted to give you direct communication so that you know the full-scale goal of what we're trying to accomplish and what we're doing on this side to keep you safe. Just know we need every one of you to practice good safety measures, protect yourselves because we need to protect each other, and we also need to continue to work to protect the community. And that is in a number of ways, whether it is through our continued service or through practicing good measures so that we all remain safe throughout this entire time. I look forward to talking to you. Please, if you have questions, just let us know, and we'll be happy to entertain them. Thank you.
So once again, I would like to remind everybody, we will be taking your questions. If you have a question, please press 7 on your dial pad right now. You'll be connected to a screener, and once you get on with the screener will take your question and put it into the system so we can read it and we can respond to your question in real time. So again, that's press 7 to ask questions during this time that we have together. In addition to that, I would like to also ask some questions of you throughout this phone call. So continue to press 7 if you have questions, and we will screen it. We're getting our first questions right now that we're working through, so giving time to get those in, I will ask our first poll question. Here it is. Do you feel that you have received adequate information regarding COVID-19 from your department? Press 1 for yes. Press 2 for no. Once again, the question, do you feel that you have received adequate information regarding COVID-19 from your department? Press 1 for yes. Press 2 for no. We're going to have about 2 to 3 minutes to respond to that. After about 2 or 3 minutes, I will remind you have another 30 seconds to close before we close that question out, and then we'll move on to our next question. So we've got 2 things that you can be working on right now, and let me move now to our first question of the day. Our first question, if we are under a state of emergency, why are we not receiving emergency pay? Please stand by for a moment as we prepare to answer that question.
The federal government declared a federal state of emergency a few weeks back, and then the state did, and the city did. But there is no city in the state of Alabama that I'm aware of under the state emergency that people are receiving the type of pay referred to in this question. Every employee on this call, based on the CDC guidelines, has been deemed essential. And so all employees, essential or non-essential, but for all city employees, are making the same pay based on city government employees, state government employees, and federal government employees all being deemed essential. But being deemed essential doesn't automatically trigger some different form of pay, and you're still doing your ordinary course of work in your ordinary line of duty.
Okay, our next question. Have any police officers been exposed or infected? If so, where?
As you know, across the nation, each state has a different level of effectiveness or different level of exposure. Some states out west, like California, and on this side, New York, in addition to Washington, have received significant exposure because they have international travel, international airports, and things of that nature, and folks coming from all over the world. And so the exposure level is going to be extremely different in various states. There have been reports in Los Angeles that I believe the last one that I read that approximately 9 people have been impacted by the COVID-19. In Detroit, there were about 7, if I remember correctly, that have been impacted by the virus, and I'm not sure of the number in New York. Here in Alabama, we've not had any cases of law enforcement that have been reported affected by the C-19, and therefore we will continue to press forward and do everything that we can internally to protect our employees.
Thank you, Chief. So I want to reference once again the poll question we asked. Do you feel that you have received adequate information regarding COVID-19 from your department? Press 1 for yes. Press 2 for no. You have 30 seconds to respond to that question. Now let's turn to our next question on this call. What type of protocols does BPD use to sanitize patrol cars and buildings?
So this is Chief Smith again. So we just started with the sanitization of several facilities throughout the city. First, we started with the jail, the municipal court, and it is my hope that we will start with the precincts. The equipment that has been issued throughout should be sufficient to sanitize your vehicles, such as the disinfectant, things of that nature, should work for a vehicle to wipe down the high-use areas, such as the steering wheel, the dashboard, the control device to place the vehicle into gear, in addition to the radio and other areas inside the vehicle.
So just as a follow-up, this is another individual, Chief, I would like to ask on this. So I think you basically, you responded to that, but just to kind of drill down on it a little bit, you said there are enough disinfecting. Are there enough disinfecting supplies to keep every patrol car and officer clean?
So what we've done is I got with the Chief of Operations, Chief Moore, just the other day, and all of the equipment throughout the city in non-operating departments, such as Parks and Recs and other areas, were brought to the Birmingham Police Department so that we, as the police department, being mobile throughout the city, would have sufficient equipment, sufficient disinfectant and things of that nature to make sure that we're able to supply the precincts. We provided additional PPE to our jail so that when you would go there, that you had sufficient gloves and protective equipment as needed.
Okay. Before we answer our next question, let me turn to our next poll question. This one is dealing with protocols. Do the COVID-19 protocols that have been put into place make you feel safer? Press 1 for much safer. Press 2 for somewhat safer. Press 3 for not much safer. Once again, do the COVID-19 protocols that have been put into place make you feel safer? Press 1 for much safer. Press 2 for somewhat safer. And press 3 for not much safer. So that question will be open for about 2 to 3 minutes. I will remind you just before we close it out. And we will close that out and we will move on. So let's turn to our next question. A lot of calls calling in can be taken over the phone rather than going out in person. Could we work on that?
Chief Smith again. Actually, this is something that we're looking at, but here's the thing. In other areas, this has been done in different states. However, different states have different laws as it relates to handguns and other weapons. Firearms are a way of life here in Alabama, and we can never treat a supposedly low-level call as if it's not significant. Oftentimes, we have to go on scene to triage a call to know what's going on before we can just decide to take a report. You have no idea how many shootings you may have prevented just by being on scene. As of right now, we're going to continue to work the way we have to make sure that we're providing significant support to the citizens of this city and protecting and serving the way that we should. In the very near future, should this continue past April 1st, then we plan to implement other measures to whereas we are able to refer citizens to a number to take a report. So this is something that we're working on, but for right now, we need to continue as we have been so that we're providing significant support to the citizens who need it.
Our next question, are we moving to 12-hour shifts and when? Would like to prepare family members for shift changes.
At this time, we have no plans to move to a 12-hour shift. Our current structure of the 10-hour shifts is working significantly well to address the concerns. There's no reason to alert your families of any significant changes thus far.
Let me remind everybody of the current question that we have up. We will close this one in 30 seconds. Do the COVID-19 protocols that have been put into place make you feel safer? Press 1 for much safer, press 2 for somewhat safer, or press 3 for not much safer. We will have 30 more seconds, and then we will close out that call. Stand by for a moment while we load the next question.
I'll answer.
So here's the next question. Rehired employees were told that they could get sick time back. What do you think we will receive? When do you think we will receive that time back? It has been over a year.
This is Mayor Woodfin. Let me address this. This is something that your police chief and his leadership team have championed, and it looks like it's been cleared in HR too. I think it's now in legal, and it will be incumbent upon me to address the leadership in the legal department to check in on this and get an update of why this has not been received yet, and they need to move with deliberate speed to make good on this.
This is Chief Smith again. This is not something that we're placing on the back burner. This is something that we have been working on for quite some time. I really want to thank the HR Director, Jill Madijic, for staying on top of this, and she's been working in your best interest to get this done through HR and through legal. It's already cleared HR and it's in legal, and once that is done, I'm absolutely certain we'll get it out there to you.
Our next question, why do officers that have to take off for quarantine have to burn their own time? Ms. Madijic joins us now.
Officers who are exposed and have to quarantine as a result of an on-the-job exposure will use city time. They will not be using their own time. The only time personal time is required is if the officer has to quarantine as a result of out-of-state travel or something that occurs outside of the workplace.
Thank you, Ms. Madijic. Let me ask you the next question in our poll. Have you encountered anyone who you believe has had COVID-19 symptoms? Press 1 for yes, press 2 for no. Once again, have you encountered anyone who you believe has had COVID-19 symptoms? Press 1 for yes, press 2 for no. You have 2 to 3 minutes to respond to that. I will remind you of the question again before we close it out. Our next question from callers. Why do some administrative clerks only work 5 hours where the other professional staff are required to work a full 8 hours? And why are some city employees allowed to work at home while other city employees have to work the full 8 hours on site?
I'll take the second part of that question. This is Mayor Woodfin. I want to make this clear. According to CDC guidelines, all employees, city, any city, municipal, local government, all employees for any state government, and all employees of the federal government, by definition, are essential. However, there are some exceptions and exemptions that we use our authority to grant. We first engage the department heads to see, in an emergency situation, who could work from home and who could not work from home as it relates to still providing our basic services at full capacity. Those department heads presented that to me. I okayed it. From there, we implemented this temporary process of allowing some people to work from home. This is temporary. This is not forever, because we are in an emergency situation unlike we've ever seen for our city. And so I don't want anyone to believe there's some divide or other folk are being treated differently. All of our employees will continue to be paid the same. We will continue to check in with our department heads weekly on those who are working from home versus those who are not working from home. I have some other thoughts, but I'll turn it over to Chief Smith for the first part of that question, which related to why I believe some people working only 5-hour shifts and others working different hours.
Okay, so what you're doing is comparing yourselves to employees who have special needs. Right now we have employees who are on various shifts, and they are done that way for different reasons. Number one, the first level employee are those who are considered by the CDC who are essentially, it could be deadly if exposed to the C17 or C19 virus. And so that being those with weakened immune systems, those over a certain age, those who are being treated for certain diseases, or those taking certain level of medications. So that's one level of employee. There's another who have the ability to complete their jobs from home that really have no public contact. So if an employee can continue to work and remain at home because their job does not require public contact, then we're okay with that. And we've been trying to work those things out so that we're able to fulfill the obligations of the department. There's another level of employee who remains, who are doing 5-hour day split shifts, who also remain on call and as needed and fill in for others, and they're on a rotating shift. And that is to reduce the exposure of employees within the city while we are still trying to operate and meet the needs of and demands of the citizens without having to shut down the building or shut down other areas. And then we have employees who fall into the critical needs. Those are employees who have public contact or are working in critical areas and critical functions that have to support our officers directly to make sure that that everything is fulfilled. Citizens are addressed whenever they come in. They're able to make over-the-counter transactions and deliver the necessary functions to the citizens that we need to make sure that things are going in the appropriate manner. And so those are the various levels, and there could be a couple that I missed. But those employees that we can let go, we on one of those scales, we have done so, and each day we continue to evaluate our posture as we attempt to address all service needs for the city.
Here's a protocol question for you, Chief. Please explain the process if an officer contracts the virus. I would also say, please, if we can talk about the process if somebody believes they have been exposed.
Okay, so we have been working with HR, and we also have a safety officer on working with us so that all exposure levels go through the same process. Those who feel they have some level of exposure, those who come and say that I have a friend of a friend who knows a friend who has it, different ways of reporting. And so far we have gone through several levels of review. We track each instance that comes up, each one that is reported, information that is brought up. We are going through the entire process to make sure that each employee concern is addressed, and we also maintain record and file of anyone who feels that they have been exposed in some way, shape, form, or fashion, so that we know the difference and we're able to provide timely information should something come up at any time and an employee is in fact infected, because it is my belief that those instances should be considered an injury on duty, and the employee will not be using their own time.
Everyone, hold on 1 second, please.
All right, so before we ask our next question or address our next question, we have a question for you, or actually a reminder that we're closing out this next call, or this next question. Have you encountered anyone who you believe has had COVID-19 symptoms? Press 1 for yes, press 2 for no. Have you encountered anyone who you believe has had COVID-19 symptoms? Press 1 for yes, press 2 for no. We will close that call out in 30 seconds. Our next question has to do with the shelter-in-place ordinance that was passed by the council yesterday. Are we enforcing the mandatory shelter-in-place, and when will it begin? Will arrests be made for violation?
Okay, so what we're doing now is we're in education mode, educate over enforcement. And so the first round of what we're doing is to make sure that the public is completely aware. Our job is to work to gain the cooperation of the public, and we need everyone in the public to take ownership of this problem. And so right now we're in education mode. We're printing up flyers so that they can be brought to you and you can disseminate them to the public, giving them timely information on what's happening. You can tell them the safety precautions. You can remind them about the shelter-in-place order, and you can ask them to disperse. We don't want to over-police this thing, but we do want to gain the compliance of the public, and therefore we will remain in education mode for a little while. Probably next week or so, we'll shift to enforcement mode. For those who do not believe in following the direction or orders or things of that nature, then we'll get information out to you about enforcement and the direction that we will take as it relates to enforcement. But right now, I want everyone to try to educate the public of the concerns, the order, the safety precautions, the necessity to follow the safety guidelines, to wash their hands, to disinfect, to keep social distancing, and a number of things that will keep them safe. So please remain in education mode of the public right now so that we can gain their overall support for what we're trying to accomplish, because we need them to support us, and we also need them to follow the guidelines.
Thank you, Chief. Before we answer our next question, we have another question for you. Have you or anyone in your household been tested for COVID-19? Press 1 for yes, press 2 for no. Have you or anyone in your household been tested for COVID-19? Press 1 for yes, press 2 for no. You'll have 2 to 3 minutes to answer that. I will remind you before we close the call out. Our next question. Are we tracking the number of cases in the city of Birmingham or just on the Jefferson County level? If so, where can we find this information?
So you wouldn't, that information wouldn't be publicly available because of HIPAA. What you can, when the first case came out 2 Fridays ago, I want people to remember they didn't say the city of Montgomery, they said Montgomery County. Then when the second case was in Jefferson County, they didn't say what city the person was from. It just said a case in the county. I think the medical experts and health experts are doing that on purpose, not necessarily sharing what city, but they're sharing what county a person tested positive from. But there is some information on those who are getting tested, and separate from their actual results of testing positive or negative, we do know out of over 2,200 people who have tested as of last Saturday, we know probably about 370 of those people were from the city limits of Birmingham. It doesn't mean their test was positive. It just means the total number of people tested, and they were from all over. They were from all the zip codes you can think of: 35207, 35206, 312, 11. 228, 212, 205, and so many other codes in the city of Birmingham. But around the actual people that tested positive, that information would not be available to us.
Mayor, if I can also say, as far as the information on a county-by-county basis, if you go to alabamapublichealth.gov, that's alabamapublichealth.gov, and you click on the State Health Department's coronavirus page that's on the main page, you will see they have a county-by-county breakdown based on the reports on a daily basis. We also have a link to that at birminghamal.gov/coronavirus, but you can go straight to the health department for that update on the daily response. So as we get ready to ask our next question, let me close out this current question we have before you, have you or anyone in your household been tested for COVID-19? Press 1 for yes, press 2 for no. Again, have you or anyone in your household been tested for COVID-19? Press 1 for yes, press 2 for no. We will close this question in 30 seconds. Stand by while we load our next question. Just one moment. Okay, our next question. 331 Detroit police officers are quarantined as of today. What do we have in place in case hundreds of BPD officers have to be quarantined?
Okay, so as you know, Detroit is one of the areas that's been hit pretty hard by the C-19 virus, and their testing has fallen behind, whereas their reports of symptoms are incredibly high. I've been staying up to date on Detroit, paying attention to many of their protocols. Their chief of police, James Craig, I know him personally, and receiving information from them on a regular basis. So what we're doing here in Birmingham is we've identified immediate locations, whereas if an employee has to be placed on quarantine, then we have a special location reserved where we will take our officers to be quarantined for the duration of that time, unless it is, if it is a confirmed case. If it's just, I've been exposed, but there's no proof, no anything other than mild symptoms, in many instances, those employees can go home if something of that nature comes up after screening. But we do have a plan in place. Not only do we have a plan for the quarantine of our employees, we also have a step-up plan in case employees a large number of employees are pulled offline. If employees are unable to, let's just say one watch is impacted by the virus, we already have a number of plans in place, not just for quarantine, but also for continued patrols in the various areas of the city.
Thank you, Chief. On our current question, have you or anyone that in your household been tested for COVID-19? Press 1 for yes, press 2 for no. We will close this one in 30 seconds. So this question, I apologize. We already closed that question. Forgive me. I got behind for a moment. We'll pull up the next question. If it were readily available, would you be tested for COVID-19? The question is, if it were readily available, would you be tested for COVID-19? Press 1 for yes, press 2 for no. Once again, if it were readily available, would you be tested for COVID-19? Press 1 for yes, press 2 for no. Our next question, the county has restrictions on who they are taking to jail. Are there restrictions on who we can take to jail?
So we've been working regularly with the county. In fact, we had a upper-level meeting with most of the upper-level folks on the sheriff's staff as it relates to housing. We've gone through their protocols. We've discussed with them about our requirements for arrest for felonies. We've also discussed with them about their standards and protocols in place and how it has impacted the Birmingham Police Department. We've worked with the sheriff to ensure that every person that we arrest that we need to bring to the county has the ability to be brought in for booking, and if they decide to release them on the other end, that's completely up to them. But we're going to continue to our business as usual, making the arrests where necessary and doing everything that we can to keep the citizens of Birmingham incredibly safe. Right now, we do not have restrictions on the people that we arrest. However, we are working with Judge Sparks on the other side so that we can minimize the impact on our jail, and if we're able to cite individuals out, we are also able to do that.
Thank you, Chief. Our next question. If an officer becomes exposed, how is it determined if the officer was exposed on duty or off? Will workman's compensation kick in? Ms. Medizik?
Officers who are exposed and test positive for COVID-19, all that will have to be established is that that individual was exposed to an individual that had COVID-19 while on the job, and the workers' comp will kick in and pay for those benefits.
Thank you, Ms. Medizik. So our current question, if it were readily available, would you be tested for COVID-19? Press 1 for yes, press 2 for no. We will close this question in the next 30 seconds. So press 1 for yes, press 2 for no. Our next question, what's the possibility of suspending checkpoints?
That's already been done. We suspended checkpoints probably a week ago. Should have already been out to your precinct, and we should not be doing checkpoints at this time.
Our next question is, how long is the shelter-in-place ordinance, how long does it last? It will, as it is written at this time, it ends on April 3rd. We have made the comment publicly that we will extend it if needed based on the situation. We will react based on the timeline based on the current situation we are in. Stand by as we get to our next question. Chief, I know you talked about this early, but I do see a variety of questions that are popping up that are similar, so these are likely people who are just getting on the line. The question dealing with the stay-at-home, shelter-in-place ordinance, what's the best way to enforce the stay-at-home ordinance?
Okay, you ready?
Yes, sir.
Okay, so the stay-at-home ordinance, as I mentioned earlier, is about educating the public right now. As I mentioned, we're getting flyers out so that we're able to educate the public on the need to follow the order. We're going towards education over enforcement. Right now, we need to make sure that our citizens know the recommendations of the health department, so we'll be getting flyers out to you regarding the recommendations of the health department. And the other part is we'll also be getting information out to you so that you are able to educate the public on the stay-at-home ordinance, and so that we can gain the citizens' compliance voluntarily versus enforcement. Should it become necessary later to whereas we enter the enforcement mode a little bit further down the line, then we'll do so. But right now we want to work more cohesively with the community to get voluntary compliance.
Chief, this is another question similar to what was asked earlier in the call that we want to touch on again. Why are we still taking calls that can be handled over the phone by a desk manager, like dog calls, neighbor disputes, and civil disorders, things that can be handled over the phone?
Okay, first, as I mentioned earlier, a number of things have a way of escalating from being a simple call to a man or person with a gun call very easily. It's important that we continue to police the city in a good manner, responding to calls, those that we can handle differently. We're going to implement different measures later on should this continue down the line. However, for now, we're going to continue to respond to all calls as needed so that we're able to address the concerns of the public.
We have several questions along a topic that has been brought up before, but I would like to, because obviously there needs to be a little clarity. This is the two that I'm looking at right now deal with workers' comp. It's variation on a question we had earlier. How do you know if an employee is exposed if the person is asymptomatic? How does it affect coverage?
My understanding is that if a police officer has been exposed by a patient, when by someone they've come in contact with, the medical facility will reach out to the department to advise them that there has been an exposure, and we will reach out to the officer to let them know that they have been exposed to a patient who tested positive.
So we have another question to ask that we are going to ask you before we turn back to asking the questions that you have on the calls. Our next question deals with, do you feel you have been provided the appropriate PPE to assist you in performing your job duties? A question again, do you feel you have been provided the appropriate PPE to assist you in performing your job duties? Press 1 for yes, press 2 for no. We will give you 3 minutes to respond to that, and then we will remind you before we close that out. That leads to our next question. Stand by one moment while I load this. Are we looking at obtaining masks, any kind of N95s to prevent us from inhaling the virus? Stand by 1 second as we prepare to answer the question. Chief Smith?
Okay, so some items right now are on back order and backlog, not just for us, but throughout the nation, for hospitals, and this is one of those items. While we have provided normal PPE for our jails and other facilities, and what we're doing is we're placing an order for this particular type of mask. However, we have to know that this type of order is in demand for everyone. It's in demand for hospitals and on down the line. So this is something that we're ordering, but just know that these things take quite some time during this time.
So we currently have a question that we have asked you if it were readily available. Actually, let me rephrase that. We asked you, do you feel you have been provided the appropriate PPE to assist you in performing your job duties? Press 1 for yes, press 2 for no. We will close that call out in 30 seconds. Let me ask one other question here. This one is for the mayor. Since there is not a cure at this time, what would the mayor need to see before we go back to a normal routine?
Well, that's a great question, but it's not what I would need to see. It's what the Jefferson County Health Department, along with their leadership team, along with the leadership team at UAB Health Systems, who both organizations have given us ample, truthful guidance on what's happening in our community. A lot of what you all have seen us do is from our daily briefings with the health department, move on the recommendations they're making towards us, which is flatten this curve as much as possible. For the foreseeable future, there is no distance between the mayor's office and the Jefferson County Health Department. Because of that, it's not necessarily what I need to see. It's what the health professionals need to see, and the recommendations they'll be making not only to me, but to the mayors, the recommendations they'll be making to mayors across the state.
Thank you, Mayor. Our next question, are personal transfers still an option?
Nothing has changed as it relates to transfers, and we will consider everyone that comes through.
Thank you, Chief. Give me one more moment. We're going to load one final question for this, and then we will finish out with comments from the mayor. Just to let folks know, as we continue through this call, we have a number of questions. It would take us, we're trying to get through as many of these as we can, and we have gone through a good number of them, but we still have a number of questions. These will be filed, and we will be working to find responses for you. In addition, if there's a question that has not been raised that you would like to ask, you can press 7 and stay on the line immediately after the call ends, and you will have an opportunity to leave a message. So I just want to let you know that. As we go through here, just one moment as we, just 1 second as we get to questions. Okay, we've loaded the question. Our final question for now is, will employees entering precincts and headquarters be required to take body temperature readings?
At this time, we have no plans to implement a temperature reading for any employees working in any of the facilities. Please know that there are several symptoms as it relates to COVID-19. Temperature is only one of them. And also, please know that your temperature can be influenced by a number of things, such as infection, such as the medication you take, such as a form of cancer, or even obesity affects your temperature and body regulation. So there are some people who, by definition, would often run a fever just going outside. So we do not plan to use this as an indicator of the COVID-19 virus right now, because there are too many things that can trigger but not be a part of the virus.
That concludes the question and answer session of this Tele-Town Hall. I would like to now turn to Mayor Woodfin for closing comments.
Thank you, Rick. Before I make some brief closing remarks, I would like to give the floor to the chief and see if he had any closing remarks to the men and women who make up the Birmingham Police Department on this call.
Hey, just know that first I want to say that I'm very proud of all of you for joining us. I'm very proud of the work that you do out on the streets each day to keep the city safe and work with others. Right now, we've taken a number of safety measures to make sure that you are safe while you do your job. I want you to remain safe while you're out there. Use the same precautions that the health department has determined for everyone else. Please keep the social distancing. And as you know, we've stopped all training thus far. We are doing field roll calls. We just graduated a class of new recruits, and we postponed their graduation, and they should have joined you already in the field. However, we need you guys. We need every last one of you. We need every last one of you to remain safe. We need every last one of you to continue to work to provide a quality level of service to the citizens of Birmingham. And just know that I'm here supporting you 100% of the way, and I'll do everything that I can to make sure that you have the tools that you need to make sure that you're able to do your job in the manner that we all expect of you. Thank you.
Thank you, Chief Smith. I also want to thank the Birmingham police officers on this call. I want to thank you all for being on the front lines protecting this community. I know this is unprecedented times in this city, and I know many of you all wake up every day not only worried about the men and women you serve with, not only the people you protect, but you're worried about your own family members as well. I'm more than confident in saying we'll get through this, but I know because this situation and the health crisis is so fluid, what was true yesterday, what is true today, can totally be different tomorrow. Because of that, I ask that you all, you ebb and flow with us in leadership as things move so fast in policy, in people, in personnel, and operations. And so bear with us, be patient, but at the same time continue to show a sense of urgency, putting people first and protecting the people of this city. Thank you for your time. We'll remain in constant contact with you. Thank you.
Thank you, Mayor. That concludes this Tele-Town Hall with Birmingham Police. Thank you so much for being with us today. Just a few notes for you moving forward. If you have an additional question, press 7, and once this call is complete, you will be able to leave a message concerning your question, and we will follow up. Also, once this video or once this audio file is downloaded, and it's a very large file, so it will take a little while to download it, but we'll have it before the end of the day. Once this file is downloaded, we will place it on the birminghamal.gov/coronavirus page. You will be able to go back and replay it if you'd like to. It also gives you an opportunity to share it with coworkers who may not have joined us on this phone call. So please know that if you need, you will have that opportunity. You will be able to re-listen to this later on and share it with others. Thank you for all that you do to serve the city of Birmingham and to keep us safe. We thank you, and that concludes this call. Have a good day.